Production funding for Behind the Headlines is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
How Memphis is and should be coping with coronavirus. Tonight on Behind the Headlines. I'm Eric Barnes with the Daily Memphian. Thanks for joining us as we continue to do the show remotely. We are joined today by Dr. Manoj Jain, an infectious disease expert who is advising the Memphis-Shelby County COVID-19 Task Force. Thanks for joining us.
Glad to be here, Eric.
We've also got Bill Dries, reporter with the Daily Memphian. So, Dr. Jain, we'll talk through all kinds of issues today and how the city county is coping, what we should be doing, what we haven't quite gotten to. But one question I have is, what number do you look at, or numbers, kind of on a daily and weekly basis? You know, we in the media, people online, they look at deaths, obviously, and that's obviously the most tragic. The number of cases, the amount of testing. Some people are very focused on ICU beds. What do you look at in terms of hopeful numbers and concerning numbers?
So I'm glad to hear, Eric, you only have one question, but but I'll tell you this. There are actually two numbers that really matter to me the most. Number one is the number of new cases every day. Why is that important? When you look at the number of new cases every day, we know what level of interaction activity was going on about 7 days before. Because usually the number of cases that occur are going to be 7 days delayed from the interaction. So if we put in a new measure, 7 days later, you'll see a decline in the number of cases. Now, that's one number that is somewhat reliable or unreliable from the sense that it can be delayed by testing. The second number I really look at is the number of hospital beds occupied with COVID patients, or the hospital census. What that tells me is, one, at the level of capacity compared to the level of capacity we have, but it also is a very reliable marker. Suppose people decide they don't want to get tested. Well, that first number could be a little difficult to understand. But really, when people are getting sick, they really don't have an option. And that number tells us the number of hospitalizations that are occurring as to the prevalence of the disease in the community.
So with that's really helpful. Thank you. Because there's always been this kind of conversation about, or always, in this past month or 6 weeks, about, looking at the number of cases is always relative to the amount of testing. But sure. I see in a way that I hadn't been clear to me that the hospital beds fill up, testing or not. That makes tremendous sense to me. Right. So to that end, where are we in Memphis-Shelby County in terms of the utilization or occupying hospital beds? Is that number steady? Is it falling? Is it rising?
So actually, it has stabilized. 2-3 weeks ago, we were on an exponential rise, and that was quite worrisome. But over the past week to 10 days, we've stabilized about 110 admissions, 110 bed census in the greater Memphis area. And that's really reassuring because that exponential rise has flattened out.
Yeah, and I should note before I go to Bill Dries, we are taping this on Thursday morning. So those numbers are going to move a little bit as people watch this over the next couple of days. But let me get Bill Dries in the mix here.
Dr. Jain, are the hospitals still in danger of being overwhelmed by this virus when it reaches its peak, which the current estimate, I think, is late May to early to mid-June?
Hi, Bill. Very good question. And what we were quite concerned, again, several weeks ago, and this is changing very rapidly, was the continuation of that exponential rise in the number of hospital beds being occupied by COVID patients and the number of cases coming. We have seen clearly a flattening of that curve, and there is no question it's the sacrifice of the people in Memphis, in Shelby County, that has done that. And I cannot tell you and thank people enough for sacrificing the social interactions that they have. So the question now is, will that rise continue, or is that flattening, and then could there be a decline? And what is our capacity? It's hard to tell, but overall, I feel confident that we have the capacity to manage the cases that we have, even if there is and continues to be a rise. I do not believe we will see any scenario like we have seen in New York and Italy or other places. So that is quite reassuring. Again, it greatly depends on our ability to keep the social interactions reduced, and the social distancing that we talked about, the physical distancing that we're talking about, to the minimum, so that the numbers don't go up.
So as we record this, we are about to head into a weekend where 5 of the 8 city golf courses will be open in Memphis. The private golf courses will be open. The fully automated car washes will be reopened, but also big box stores across the city will have a new policy that they have to only let a certain number of people in, and workers in those stores have to wear a face mask and similar precautions. Are you a little nervous about this weekend?
So we have to take it in stages. And there's no question we have to work on reopening, but the reopening has to be done in the new normal. And that is what's critically important. And we have to be thinking about what are ways that we can make an impact of reducing the curve and or maintaining it, and not allowing ourselves to not reopen.
Mm-hmm. All right. And is our tracking at the point now where we're dealing with this as close to real time as we can get? I know you talked about the 2-week lag, but earlier we didn't know exactly how many people were being tested. We didn't know the racial disparity in the numbers, all of those things. Now those numbers have come online. So is this about as close to real time as we get in dealing with it?
Exactly. So for testing, yes, we are very close to real time in knowing the tracking of how many tests and the results. And the results are actually, turnaround time is improving within 24 to 48 hours. Before, there was a long delay. Now we need to be talking about the tracking for contact tracing. You see, the 2 core elements to contain the epidemic is testing and contact tracing. This is the second phase of what will be our strategic approach. In that first stage, this was a sort of a blunt approach, which is, look, everything shuts down, social distancing, lockdown. That is the blunt approach we took for the first couple of months. Now we're taking a more surgical approach, which is expanded testing, contact tracing, isolation, and sentinel surveillance.
All right. And I believe Eric has some points on that as well.
Yeah, with the notion of testing, we are still, by and large, if I'm not mistaken, in Memphis and Shelby County, only testing those who are primarily testing those who have are symptomatic. Is there a point at which we begin to do more mass testing to just, again, sort of identify where the virus is happening and kick in that contact tracing that you're talking about, and Mayor Strickland talked about last week and others have spoken about? When does mass testing begin, and does that capacity exist?
So great question, Eric. And Mayor Strickland and I spent a lot of time actually yesterday having this conversation in great detail. So the first step in testing is that you want to test everyone who is symptomatic. So anyone who has a fever, cough, shortness of breath, vague symptoms of not feeling well, and we don't know if there's another cause, all those individuals need to get tested for one and many reasons. First is because the COVID virus is actually for us clinicians, making it very hard to figure out what are the clear symptoms. I had not realized over time that very vague symptoms, such as feeling fatigued and all, could be a presenting sign, and we send a test off, it comes back positive. So what we want to be doing is, focusing on those who are symptomatic. And then we want to shift to those who are targeted asymptomatics. What do I mean by targeted? We don't want to be going and testing everyone in the population generally, because one, it's not good use of our resources. You want to be going where individuals are at high risk, such as emergency room doctors, nurses, first-line workers, nursing home workers. And so that group is a targeted group that we want to start testing. We're testing maybe about 750 people a day. We want to be expanding to up to 2,000 or more per day. And the reason is because that's what the national guidelines, suggestions have been from experts, that, look, you really have to expand that level of testing to make sure you know where you are in the epidemic and that you can work to contain. If we see certain target groups have a high percentage of positivity, then we need to do more testing. If we see low level of positivity, we do less testing.
What then stands in the way of getting to 2,000 tests a day?
So, very good question. It's actually a lot of logistics. And it's 4 steps which are very critical in this testing. One is the laboratory, making sure that the lab has the capacity to do the tests. Second, you need the kits. Third, you need the staff to be able to swab and do the test. And lastly, what you want to be able to do is to have those individuals come and get tested. Sometimes we give mixed messages in the media where we say we don't have capacity and so should or shouldn't get tested. And the population's response is somewhat delayed. The message doesn't get across. And we have sometimes capacity, such as in Tiger Lane, we have capacity to do tests, but we're not having enough people come.
Is it that, people maybe feel like they are a little sick or a little symptomatic. Maybe they don't have a regular doctor. Many people don't, particularly people with lower income people don't have regular doctors. Do you need to allow people who just feel sick to go to Tiger Lane and go to some of these other places without a doctor's recommendation?
Absolutely, and they're doing that. If you are feeling ill, if you feel that you have some symptoms that are vague, and let them know. So they're doing that. So that means you fall into that category of symptomatics. Also, Walgreens is opening up, and that they will be doing testing, and it's at no cost. And so there are cities in our city, there are areas where we have that ability to do testing at no cost, or insurance will cover symptomatics, and also healthcare workers who are going to get tested and there's a doctor's order.
Okay, but again, someone who is feels symptoms, doesn't have a doctor, doesn't have a doctor's recommendation, they can go to Tiger Lane and these other locations and get tested and just
absolutely
talk to
absolutely
the people.
Yes.
Okay, we'll go back to Bill Dries for some questions.
And I believe that when they get to Tiger Lane, if they don't have a doctor's referral or a doctor's word on this, that they'll be asked some questions in advance of scheduling the appointment. Is that how this works?
So what's really important is to call ahead and to schedule an appointment. Why? For one and many reasons, you won't have to wait as long. But the other is that the healthcare providers on the other end can really gauge what's the best way and best place for you to go. Suppose you're calling and you're having shortness of breath, chest pain, and that's then going and getting testing at that time is not the right place to go. You really need to go to the emergency room, to call the emergency room and then be seen there. So I think that's really important to call beforehand, schedule an appointment, tell them your symptoms, what you're feeling, and how you can and where is the best place to go.
as we deal with the backstory of this, we're dealing with the present a lot now, but as we continue to develop the backstory, are we going to find that people had COVID-19 in December or January before we started really looking at this all of a sudden?
So great question, Bill, and you're absolutely right. And actually now we have a test that can give us a quantitative number of how many people have been infected in the past months. So this test is an antibody test. It's a blood test. And what this blood test does is it looks for your antibodies to coronavirus. And if that antibody test is positive, which means that you likely had COVID-19 over the past several months, and that you're likely to be protected. We don't know the exact science on what level of antibody will lead to what level of protection, but we believe that you will likely be protected because we know this experience from SARS, and for at least 9 months, that antibody will be likely there. So getting that blood test is a very important in determining who is immune and who is susceptible. In fact, our whole society for the next months to years will, until we have a vaccine, will be divided into 3 categories of individuals. One, who are COVID infected. So if we do that swab, then, and you have an infection, that's a COVID infection. Then antibody test will tell us if it's positive, that blood test, that means that you are COVID immune, that you have had the virus, and that it's unlikely that you will get the virus again. If you do the antibody test and it's negative, then that means that you are susceptible, that you could get the virus. So
right.
COVID positive, COVID immune, and COVID susceptible.
All right, and before I throw it back to Eric, all of the medical institutions, the healthcare institutions that we have in the city of Memphis, has that been an advantage in the city's response, the county's response to this?
Oh, I absolutely. I have to compliment all of the hospitals. You know, by nature, the hospitals in our city have been competitive, but they have all worked together. I have been on conference calls with them constantly. Also, we have a task force meeting where the CEOs of the hospital are on that phone call as well. And they're talking amongst each other, sharing ideas, even sharing the testing kits. One hospital didn't have testing kits. Another hospital pitched in and gave them the testing kits to move things along. So a very collaborative atmosphere.
Let me talk a little bit about, we talked about the notion of reopening. And so as of May 1st, Governor Lee has said there's going to be a more major reopening, but to clarify, the city is going to make their own choice, including Memphis and Shelby County. For you, people are anxious to get reopened. And some of that is, just the sort of, on the lighter end, it's the stir craziness or boredom. On the much more serious end, it's economic, right? I mean, that's a huge factor right now is people in their jobs and businesses that can't open and so on. What besides the testing, and we talked through that, what sort of measures are going to have to be in place for us to be able to reopen and get back to some semblance of normality?
So great question. And actually, I'm on the task force, which is a statewide task force that's working for the 4 metro cities to put together a document of what will be our guidelines or guidances for reopening. And the doctors have gotten together, and what we have sort of laid out is 4 major areas that need to be in place before we can successfully open. The first we've talked about is the measures, and the measure of the number of cases being stabilized or declining. And there are nuances, we can go into the detail, but that's sort of what one has to look at. If there's a cluster or if we expand testing, all of that can affect that number, but having a general sense that, look, we're not on an exponential rise. So that is one area. The second is our capacity. The hospital capacity has to be there in case there is a sudden rise. We can't be at 100% capacity right now. Otherwise, any increase in cases we won't have places for them to go. The third is obviously the testing that we've talked about. And the last is contact tracing. What contact tracing means is that we have the ability to take those individuals who are tested positive and then to have them followed up, monitored. We take each case, and then the health department finds all of their contacts, calls of the contacts, tells them to stay in isolation. Bill Frist and I have had many conversations, and we're writing pieces together in the Tennessean and the Commercial Appeal. And what we're also talking about is we need to be thinking about potentially privatizing or allowing a public-private partnership to work on the contact tracing. Why do I say that? Well, if you look at what happened with testing, when CDC on their own tried to do all the testing, though I have tremendous respect for CDC, I've worked in the health departments, so forth, it's really difficult to be able to scale up and expand so quickly from the health department. We have private labs that came in, and all of a sudden the testing has changed phenomenally nationally. We could do a similar thing with the contact tracing. In order to move further, employers, actually the White House document talk about employers learning to do contact tracing. Also, we could be talking about how we can be doing it at the hospitals. The hospitals have the skill sets to be doing contact tracing.
Yeah, and last week when Mayor Strickland was on, he talked about there are, the library has a certain amount of a call center kind of capacity. There's some variety that government could, of options that he discussed that government can bring to it. But when we talk about, right now the models showing, Memphis peaking in late May or that kind of, is that what we're waiting for in terms of beginning to reopen, or are we waiting to build this capacity you're talking about?
So I believe the capacity for the most part for the hospital is there. We're building the testing and the contact tracing capacity. I believe within a week to 10 days, we will come there. We're really wanting to see that curve stabilize. About 5 to 7 days, we have seen some level of stabilization. We want to be looking at 2 incubation periods, or at least one 14-day incubation period, that we can be sure that there is no exponential rise in the numbers.
With the Memphis, a lot of attention was put on the University of Washington model that showed Memphis peaking in a week ago, I think it was, something like that. When I spoke to Mayor Strickland, he said, look, we don't want to look at that model anymore. But the models are not, they're not oracles, right? They are merely models. So how much does the model, the theoretical model of what will happen, weigh on the decision-making versus the real-time data that you're getting?
So actually the real-time data is what influences us most. And the model is there, and the models are based on the level of social distancing that we may have anticipated and its impact. And when we see the numbers not increasing at the level that the models predict, then we say, wait a second, our assumptions may not have been correct, meaning that we said we would only have 40% social distancing, but we reached 55% social distancing. And all of a sudden, things change dramatically in the model. So predicting if that surge and when that surge is going to completely occur is difficult to do. But what we know is that it will not overwhelm us at present, what we are seeing. And we may just see a slow rise and then a slow decline.
With just a minute and a half left here, Bill, do you have another question?
Yes. After this is over, after, let's say we're past what could be the first wave of this, should public healthcare and private healthcare remain together in terms of their pursuit on this and on other health goals?
Well, so actually, I think you're absolutely right, Bill. We have to really rethink how we're providing both public healthcare and private healthcare. And we have to really rethink public healthcare. It has been a approach that has been relegated to the public health department. I really believe that we need to rethink that, just as we have to be thinking about preventive medicine and curative medicine sort of coming together. We have to be thinking about ways that wellness and treatment are going to be together. Public healthcare, private healthcare have to be aligned. Otherwise, we will not succeed in successfully containing this epidemic in the present time, but also in the future and any future events that happen.
All right, well, we will leave it there, but we thank you very much, Dr. Jain, for coming on. And that is all the time we have this week. A reminder that past shows are available on WKNO.org. And a podcast of the show, if you didn't catch the whole show, is available on the Daily Memphian site, iTunes, Spotify, or wherever you get your podcasts. Thanks. Join us again next week for Chief Administrative Officer for the city, Doug McGowan.